20th century witnessed significant transformations in the political and social landscape of Europe, particularly in Scandinavia. One of the most notable developments was the emergence of the welfare state in the northern countries: Denmark, Finland, Iceland, Norway, and Sweden. The rise of Scandinavian social democracy during this period had a profound impact on the global discussion of social benefits, human rights, and the role of the state in the economy. This model became synonymous with high standards of social protection, universal health care, free education, and progressive taxation. The welfare state in Scandinavia was not only a response to economic challenges, but also a reflection of deeply rooted cultural and political values of social solidarity, equality, and social justice. Origins of Scandinavian social democracy. The roots of Scandinavian social democracy can be traced back to the late 19th and early 20th centuries. During this period, these countries experienced rapid industrialization and urbanization, leading to profound societal changes. With the growth of cities and the increasing number of industrial workers, awareness of social inequalities and the economic hardships of the working class grew. The labor movement began to take shape, with trade unions and political parties advocating for workers' rights. In Sweden, the Social Democratic Party, SAP, founded in 1889, became a powerful force promoting social reforms. Similarly, the Social Democratic Party of Denmark, Social Democratic, and the Norwegian Labour Party, Arbeider Party, emerged around the same time, advocating for progressive taxation, universal suffrage, and better working conditions. These parties played a key role in shaping the political discourse on the welfare state, promoting policies aimed at improving the quality of life for all citizens, not just the elite. The influence of Marxist theory was significant, though not absolute, in shaping the initial political goals of Scandinavian socialists. However, unlike in other European countries, Scandinavian socialists were more pragmatic, focusing on gradual reforms within the existing capitalist system rather than seeking to abolish capitalism entirely. This approach became known as the third way, or a middle path between capitalism and communism, distinguishing the Scandinavian welfare state model. The interwar period, seeds of the welfare state. The period between the world wars was marked by economic difficulties, political instability, and growing social discontent across Europe. The impact of the Great Depression of the 1930s underscored the vulnerabilities of capitalist economies, particularly in terms of unemployment and poverty. The Scandinavian countries, which had relatively small populations and economies compared to their larger European neighbors, began experimenting with new forms of governance to mitigate the effects of the Depression. In Sweden, the Social Democrats came to power in the early 1930s under the leadership of Prime Minister Per Albin Hansson. His government introduced the concept of the people's home, folkhemmet, a vision of society where social welfare and economic security would be available to all citizens. The folkhemmet project was based on the belief that the state should act as a guarantor of equality and social justice. This initiative focused on universal health care, social insurance, public housing, and progressive taxation. Hansson's vision of the welfare state later became a model for other Scandinavian countries. In Denmark, the political climate of the 1930s was also conducive to social reforms. The Danish government introduced unemployment insurance, pensions for the elderly, and several other social protection measures to counter the effects of the global economic crisis. These initial steps toward building a comprehensive welfare state were not as extensive as in Sweden, but laid the foundation for further development. Norway experienced similar transformations during this period. The Labour Party, under the leadership of Johan Nygaardsvold, became the dominant political force in the 1930s. The Labour government implemented progressive social reforms, including the nationalization of key industries and the expansion of the social welfare network. Thus, the interwar period marked the initial steps toward a more active role of the state in addressing social inequalities in Scandinavian countries. Although these reforms were not fully realized until later, they laid the groundwork for the development of the welfare state. Post-World War II, the expansion of the welfare state. The aftermath of World War II provided a crucial opportunity for the further development and expansion of the Scandinavian welfare state. As Europe was rebuilding, the Scandinavian countries embraced policies that prioritized social welfare, economic equality, and state intervention to ensure a fair distribution of resources. This period saw the full realization of the welfare state model, with comprehensive social policies being implemented across the region. In Sweden, the Social Democratic Party, under the leadership of Tage Erlander, 1946 to 1969, expanded the concept of folkhemmet, focusing on social security, universal health care, and housing policies. The government introduced extensive labor market reforms, ensuring stable employment, high wages, and a robust public sector. Sweden became a model for balancing economic growth with social justice, a principle that came to define Scandinavian social democracy. Denmark, under social democratic leadership, followed a similar trajectory, implementing policies that strengthened social protection, healthcare, and education. The 1956 Social Assistance Act marked a significant step toward a more inclusive welfare system, ensuring financial aid for the unemployed, the sick, and the elderly. Norway, having regained independence from German occupation in 1945, embarked on a path of national economic planning and social welfare expansion. The Labour Party played a key role in shaping policies that aimed at full employment, state ownership of strategic industries, and the creation of a strong welfare system. The discovery of oil in the North Sea in the late 1960s further strengthened Norway's economic capacity to sustain a high level of social welfare. Finland and Iceland, though smaller in population and economically distinct, also developed strong welfare systems. Finland, recovering from the war with the Soviet Union, adopted a mixed economy model and gradually expanded its social security programs, while Iceland focused on universal health care and state-supported social services. Key features of the Scandinavian welfare model. By the 1960s and 1970s, the Scandinavian welfare model had become well established. Some of its defining characteristics included 1. Universal social protection. Welfare benefits, including pensions, unemployment insurance, and family allowances, were available to all citizens, regardless of income. 2. Public health care and education, free or highly subsidized health care and education became pillars of the welfare state, ensuring equal access to essential services. 3. Progressive taxation. High tax rates, particularly on high-income earners, funded extensive social programs and public services. 4. Strong labor market policies. Governments played an active role in ensuring full employment, supporting strong trade unions, and implementing active labor market programs. 5. Gender equality. Scandinavian welfare policies placed a strong emphasis on gender equality, promoting parental leave, childcare services, and equal pay initiatives. Sharp challenges and reforms in the late 20th and 21st century. While the Scandinavian welfare state remained resilient, economic crises in the 1980s and 1990s posed challenges. High public spending, global economic shifts, and demographic changes forced governments to reconsider aspects of their welfare policies. Economic liberalization, privatization of certain services, and structural reforms were introduced to ensure financial sustainability while maintaining the core principles of social welfare. Sweden, for example, introduced market-oriented reforms in education and healthcare, allowing private providers to operate alongside public institutions. Denmark developed its flexicurity model, combining labor market flexibility with strong social security protections. Norway, benefiting from oil revenues, maintained a robust welfare system, but introduced sovereign wealth fund mechanisms to safeguard future generations. In the 21st century, the Scandinavian welfare state continues to evolve, adapting to globalization, technological advancements, and demographic shifts. Immigration, aging populations, and economic competition have raised debates on the sustainability of universal welfare policies. However, Scandinavian countries remain committed to the principles of equality, social security, and collective well-being, ensuring that their welfare models remain among the most admired and studied in the world. Conclusion. The development of the Scandinavian welfare state is a testament to the power of social democracy, pragmatism, and collective responsibility. What began as a response to industrialization and economic hardship in the early 20th century transformed into one of the most comprehensive social welfare systems in history. Despite challenges and reforms, The fundamental principles of the Scandinavian model, universal social protection, economic equality, and a strong role for the state, continue to shape the region's policies and inspire discussions on social welfare worldwide.